Good morning. My name is Huda Nasser. I'm consultant anesthetist working at Al-Zahra Hospital. I've been working with Dr. Bizrah for more than 2 years ago. During this time, we will be giving sedation for the septo-rhinoplasty. You know that it's not so frequent anesthetists can be asked about this type of sedation. However, this sedation is composed by giving a medication which can keep the patient's sedation level compatible with the steps of the surgery. All patients should be assessed before giving them the sedation as any regular patient. Then explain to the patient what are the steps and how sedation will be worked. When we go inside the operating room, we have usually we give dormicum or midazolam, 1 to 2 milligram starting. Then we start the propofol TCI, target controlled infusion. You know with TCI that we can control the level of the sedation. Usually, when applying the local anesthesia to the nose, we have to go with a deep sedation. That means we have to go with like 5 to 6 microgram as a plasma target for the propofol. After completing the injection of local anesthesia to the nose, we can go to the mild sedation. We can go to a level like 2 to 3 microgram as a plasma target. You know that there are a huge variation between patients. So because of this, anesthetist should feel his patient. The whole surgery maintenance, we can go with propofol TCI infusion, as I mentioned. At the same time, we can give some medication which can help the sedation and can help giving the sedation with tolerating the painful stimulation. Meanwhile, the patient can have his airway, can have maintaining his reflexes. We can give fentanyl, 0.5 microgram per kg total. We can give increment of ketamine as total 0.5 milligram per kg. We can achieve the airway protection by putting an oral airway. Inside this oral airway, usually we put for monitoring the SpO2, to monitoring the EtCO2, and that's of course, the port of the capnograph will be connected to our machine to measure the ventilation. This is a very important monitoring. At the same time, the other basic monitoring should be applied, ECG, SpO2, blood pressure, etc. During the procedure, the patient can maintain his airway. Some patient can cough. Suctioning through the mouth and the nose should be done frequently by the surgeon assistant, by the anesthetist through oral airway. We can do some suctioning. Towards the end of the surgery, the patient will completely wake up, will come around within few minutes after stopping the propofol infusion. However, for post-operative pain, usually we apply what we call it multimodal analgesia. We usually give Blepharoplasty 1 gram during the surgery, in addition to any non-steroidal anti-inflammatory, in addition to anti-emetic medication. And for post-operative pain management, we can give for pain through a weak opioid like Dramal. That will be more than enough. Most of the patients, they don't complain of pain after the surgery. They can start having oral intake liquid immediately when they are in the recovery room. Thank you.